get out of this. Okay? All right, please welcome the final presentation for the day, behavioral medications in minors.
Hi, we are here to speak about the issues regarding behavioral medications in minors. So, first off, a behavioral medication is just a medication used to treat any behavioral disorder, such as ADHD, OCD, and depression. A behavioral disorder is an irregularity in the brain's function, usually caused by abnormal development in the brain throughout a child's early life. This can lead to an imbalance in the vital chemicals in your brain that, corresponding with other chemicals, can control part of your, certain aspects of a child's behavior. So, one of the first recorded uses of behavioral medication was the use of Ritalin in the early 1960s in an elementary school environment, specifically in kindergartners and first graders. And it was used to treat symptoms of hyperactivity. Now, many didn't really think of it as a medication that was able to, treat an entire disorder. They just viewed it as to treat one symptom, just kind of like another aspirin. This is similar to how other behavioral medications began. They started as something small, just to treat a couple symptoms, and grew into something much larger that could be used to treat an entire disorder. Now, behavioral medication was not really accepted as a legitimate treatment for a disorder until the book Biofeedback Behavioral Medicine was published in the early 1970s. Now, this was actually pretty much the first use of the term behavioral medicine, and it brought a lot of awareness to the subject, because many people didn't even know what behavioral disorder was at that point. If their child was acting up, they didn't really try to blame a disorder. They thought, oh, I just have a problem child. Shortly after this book was published, the National Institute of Health established the behavioral medicine study sector. And this is one of the first areas that was really dedicated to studying behavioral medication and its side effects and how it should be used. Over time, behavioral medication has become much more accepted as a treatment, and more research has been put into more sophisticated medicines and more different types of medicine, and all the as shown, the use of Ritalin has just increased significantly. And so this is good because more people around the world are having their symptoms treated, but it also brings up several issues regarding how the medicine is properly distributed and regulated.
So currently the FDA, the CDC, and the NIH conduct tests or trials to see the effects of these medications. In particular, the NIH and the CDC, they publish their findings. So they publish a list of symptoms, a list of possible causes, and possible treatments for those affected by these diseases. Currently, in the United States, 48 states of the United States have current medication guidelines, so they regulate how their citizens can take their medicines. 11 of those states have certain legislation regarding behavioral medications. One example of this is a teacher at a school cannot, so if a student had a toothache or a headache, they could not recommend Adderall or Ritalin as if it was Advil or Tylenol. Now, even with these current actions, there come concerns. First off, the testing that was mentioned by those three agencies, they're only done on adults. So the minors' the children's bodies and the adults' bodies will probably react differently to the medicines, so we won't have accurate information. And also, there can be adverse effects of these medicines, so negative effects on someone's body, either through misprescription or through abuse. So a doctor could misprescribe one of these medicines, and it could have negative effects on someone's body, or they could also abuse them. These These effects could be both short and long term. Some of the short-term effects could be increased heart rate, blood pressure, hallucinations, and even bizarre behaviors. And some of the longer-term effects could be organ damage, so damage to your lungs, your liver, your kidney, your heart, and your brain, and even malnutrition and depression.
There are multiple harmful adverse side effects of antipsychotic drugs, such as restlessness, nausea, muscle spasms, and even potential suicidal thoughts or actions. The regulations regarding safe and effective use in minors must be improved. In the past, medications were not commonly studied in children because mental illnesses were not observed in childhood behavior, and there were many ethical concerns regarding the involvement of minors in medical research. Consequently, this has led to a lack of information regarding the most proactive and safe treatment for minors suffering from mental disorders such as OCD, ADHD, and depression. Although, according to the Food and Drug Administration, over 500,000 children and adolescents are prescribed with antipsychotic drugs in the United States annually, there is a lack of information regarding how the drug affects early and long-term development. As the popularity of behavioral medications is increasing in minors, there must be more information as to how the drug will affect the growing child. Any information regarding a specific drug is placed on the back end and is reviewed by the FDA. This is known as black box labeling, hence black boxes. The black box includes proper dosage, potential side effects, and approved ages. As the use of behavioral medications is increasing, there's a scarcity of information regarding permitting safe long-term use. This is a scary but true inverse relationship, for you could be taking a drug and not even know how it will affect your body.
Due to the lack of current knowledge regarding the long-term effects of behavioral medications such as Ritalin, it is important that more studies are conducted in order to further research these long-term effects. We plan to use grant money to design and carry out a longitudinal study on the long-term effects of Ritalin in children and adolescents under the age of 18. This study would take place over the course of 20 years, and data would in part be collected by periodically discussing any behavioral or physical abnormalities with our participants. In addition to providing vital knowledge on the long-term effects of Ritalin, the study would also expand current knowledge on the short-term side effects of Ritalin. After the conclusion of our trials, our information would be presented to the FDA along with a list of proposed rules and regulations, including the more thorough labeling of containers of behavioral medication with a list of all potential side effects, both short-term and long-term. Another regulation would be requiring parents of children that plan to prescribe behavioral medication to their children to consult with a medical professional before going through with the decision to medicate their children. The implementation of these rules, as well as other regulations, would allow children to receive safer, possibly more effective doses of their medications. Tighter regulations would also help cut down on the misuse of behavioral medications, such as Ritalin. We also plan to effectively communicate all of our data collected during our study to the public through the use of online publications and medical brochures. This would allow all parents who plan to give medication to their children to receive accurate information on all of the potential risks as well as benefits of the medication they plan to give to their children. Overall, the goal of our action plan is to further educate the public on the issues related to behavioral medication, such as the long-term side effects and short-term side effects and the benefits of the medication. We plan to do this by effectively communicating data collected from a 20-year longitudinal study. We also plan to help pass new regulations involving the safer, more effective use of these medications. This will in turn help the millions of children in the United States and the rest of the world suffering from behavioral disorders to more effectively manage their symptoms and receive better treatment, in turn helping them lead happier, more productive lives.
The chart in the bottom left corner shows you the amount of children just taking ADHD medicine, the ones receiving only behavioral therapy, the children taking both medication and receiving behavioral therapy, and the ones receiving neither. The green, the one that is both the children taking medication and behavioral therapy, is a number that we hope to increase so that people are more aware of what they are taking and how it is affecting their body. We plan to do this at the University of Virginia's hospital, pictured in the upper right corner. For our short-term budget, we have an estimated cost of $150,000, and that money will be used to help us get off the ground and be able to start our research to figure out how exactly behavioral medication affects the minor's body. The bottom budget listed is our long-term budget for a 20-year period. As you can see, the cost is extensive, equaling $5,816,000. And we hope to receive extra money from the Brain and Behavior Research Foundation, National Science Foundation, U.S. Army Medical Research, and the National Institutes of Health. And we would like your funding in order to help us get off the ground with our short-term budget at $150,000.
In conclusion, behavioral problems are becoming more and more of an issue every day. While there are current regulations in place, our group will strive to fix the gaps that are missing from said regulations. Despite the fact that these medications have been in use for many years, there is still not much information regarding the long-term effects when the medication is started as a minor. Overall, our group should be funded because of the lack of information available to parents who are looking to use these medications in their children. Questions?
I'm good. Okay.